previous class of the Isra University. As usual in the starting, we will upload it on our YouTube channel and other social platform. The purpose is that this class learning is extended to other students who are not directly enrolled in Isra University, but they are learning in a different setting in this country, outside the country. Particularly two countries, India and Pakistan, have a similar approach towards public health and community medicine. So, CAP, the question will be asked, what is CAP? What is CAP? In local language, it is a kind of wearing, or we call it cap. So, the cap in community medicine is different than the cap as a dress. So, cap will be asked, what is cap? As we have BP, as we have diabetes, or some other names also there. So, even we use the word HIV for AIDS, and so the same way cap is used in public health as why it is community acquired. We will learn in this lecture. Normally, pneumonia is a clinical condition and one of the leading cause of the death of the children. But here we will use word community acquired because most of the cases can be dealt, can be treated, can be managed, can be prevented at a community level. That's why it is called community acquired pneumonia or CAP. What is the date? 12th, and we are delivering this lecture 2 days later. This was prepared a few days ago, but I think yesterday. So, World Pneumonia Day is also celebrated. And pneumo means air. Pneumo means air. So, it is basically air and lung function, because the function of the lung is to draw the air and expel the air. We call it breathing. So, this is basically a breathing difficulty, breathing disease or respiratory disease, and that's why it is called pneumonia. Next. What is this? In adults, why? In children, we call it acute respiratory tract infection, lower respiratory tract, ARI, and upper respiratory tract infection. Normally, the word is used, but here in adults, it is a community acquired pneumonia because it is a problem not only of children but of any age, adult, elderly, so on and so forth. So, millions of people worldwide are affected. So, you can't treat the millions in hospitals, and if you will have arrangement of the wards, doctors, medicines, then you will not manage other cases. So, that's why it is called, and you can see that the doctor is dealing in the hospital, but the same can be treated at the home setting or at a periphery or primary level. And the causes of the pneumonia are different. So, your management and prevention will be different. It can be fungal, it can be viral, it can be bacterial. We have two medicines for bacterial pneumonia and also for fungal pneumonia. But we have very little in our hands for the viral pneumonia. So, prevention is important. Next. Young children, older adults are more susceptible to CAP due to weakened immune system. Why it affects the lungs? The reason is the immune system is low in children, in sick people, or in immunocompromised people. Smoking also reduces the function as well as immunity of the lung, and HIV and even the hepatitis. Next. So this is important slide. Please look at that. How many symptoms? Common and uncommon. The question to you will be, which of the following is common symptom or uncommon symptom? So if this slide is there, you can see that in common symptom cough is important, but in uncommon cough is not present. So that is important point which you should remember, and even I think that can be given in our 4th year ASPE, this slide, and below you can put a question that what are the common symptoms and what are the uncommon symptoms and what is the difference between the two. So cough will be different, and vomiting also is important. Diarrhea is important in uncommon. Yes. In uncommon, so normally diarrhea is not related to the, but because immune system is weak, so you can have gastroenteritis or such kind of other things. Next, please. Diagnosis, particularly last, is sputum culture, blood test, chest X-ray, and auscultation or chest examination. So on the top